Today, psychosis is widely understood to be caused by chemical imbalances in the brain. If severe enough, the condition can leave a person unable to function normally.
So people who are suffering from psychosis really have impaired social behavior and impaired activities of daily living. So they may talk differently, they may walk differently, they may have non-purposeful behavioral movements. So typically the biggest danger with someone who is psychotic is that they cannot care for themselves. So they may not have a morning routine in terms of getting up and getting ready for the day. It may be difficult for them to attend work or school or have social relationships.
Heather Sheets is a clinical psychologist. She treats people with mental illness and trains other psychologists as well.
So the most common form of an hallucination is actually an auditory hallucination.
Hearing voices.
Hearing voices, correct. Hearing voices, hearing loud sounds, buzzing noises. Hallucinations, though, can affect all of the five senses.
Until the middle of the last century, psychologists relied mainly on talk therapy and confinement in mental hospitals to treat patients. But starting in the 1950s, doctors began finding medicines which were helpful in controlling severe mental illness.
The drugs, quite simply, have gotten better. So antipsychotic medication has improved significantly in the past 3 decades in terms of side effects lessening, and so people are more likely to stay on antipsychotic drugs, and that's resulted in hospitals today being shorter and people being released into the community, into the care of a community agency, a therapist, etc. So it really started with the medication improving, and then therapists taking a much more active approach with maintenance of treatment, so maintaining a patient's compliance with medication.
One of the biggest issues is coaching patients to keep taking their medications regularly.
So there's really 2 phases of treatment. The acute phase, where you're trying to control the symptoms, the active symptoms of psychosis, and then the maintenance phase, because once the person's psychosis remits, you want them to remain on the medication. And medication compliance can be one of the things that's difficult to treat in this population, because they start feeling better, they think that they do not need the medication, or simply they do not have the cognitive resources available to continue being medication compliant.
The treatment of people with severe mental illness has been revolutionized by the discovery of effective antipsychotic drugs, along with long-term studies looking at the effectiveness of various treatment approaches.
Here in the United States, there's a big emphasis right now on evidence-based treatment, and most of the evidence-based treatment really points to a combination of antipsychotic medication and more skill-based therapy.
Older approaches based on the work of the great Austrian founder of psychoanalysis, Sigmund Freud, have largely fallen by the wayside.
The emphasis on the former psychoanalytic the sort of stereotype of laying on a couch and having Freud sit behind you and analyze your dreams or your thoughts. There's not a lot of evidence in recent years that that is an effective treatment for psychosis.
Far fewer people with psychosis are sent to mental hospitals in America today. That's a good thing when they can stay in their communities while receiving support from a psychologist. Unfortunately, too many patients don't get the help they need and end up homeless or in jail. For centuries, people who acted crazy were either shunned or shut away. Then, 100 years ago, Sigmund Freud developed psychoanalysis. But in recent decades, there has been a revolution in the treatment of psychosis, with a growing toolbox of drugs proving effective in helping many patients lead close to normal lives. For Saudi Good Morning, this is Burton Bolag in Washington. Was that good? Okay, fine.